If someone could be a fly on the wall and just listen to these conversations, I'm surprised more people don't do what we do. It is the most amazing field. The conversations we get to have are conversations that a lot of people want to have. People want to talk about intimate issues. And who doesn't want to have these conversations all day long? You think about talking about peeing, pooping, and cancer care, and all those conversations are so important. But I think the intimate conversations can be really fun conversations to have, where when people leave our offices, they're like, heck yeah, like my life is about to get better.
So I thought we'd start out. Can you tell me like your 30-second origin story? How did you find your way into men's health and male hormonal health? And when did you realize this is my specialty?
The reality is I probably would have been happy doing a lot of different things. And as we go through medical school and we're going through all the different rotations, like at some point we just have to make a decision. Now, I was deciding between three different specialties: pediatrics, emergency medicine, and urology. And they're all very different.
Yeah.
I loved pediatrics because I love children.
Yeah.
I loved emergency medicine because so much when you're a trainee, your goal is to not get in someone's way and to actually be helpful on the team. And I felt that in the ER, because everyone was so busy, you could actually play a role in the ER in terms of patient care and actually helping out your team.
Yeah.
And then I liked urology because the stereotypical people that become urologists are cool people. We have good jokes. Honestly, I got along with the people. There was a urology resident. He was in his last year of training. And one day, his name is Lambros Stamatakis, and he said, Amy, I think you'd be a good urologist. Now, as a trainee, we are so impressionable that sometimes all it takes is one person to make one comment that can either encourage a decision or, equally as powerful, they can discourage a decision. And I think that puts the onus on us as people who are mentors and educators to say we have a lot of power in this space with our trainees. And even one comment can, make a big difference for better or worse. And then once I was in urology, through urology training, we do a lot of different things. Most of my training was in urologic cancer care, and a minority of my training was in quality of life concerns affecting everyday men. So it really wasn't until my last year of training in my year of fellowship where I saw my mentor sit down with guys and explain to adult men the basics of their bodies in a way that this light bulb really came off, And that's where I really developed an appreciation for the work that I get to do these days.
Oh, amazing. Yeah. And I think, as with all things like intimate health, so many people don't even know the basics, that we're never taught things about our own bodies. And that's so hard for people.
And now when I think about the conversations that I get to have on a daily basis, if someone could be a fly on the wall and just listen to these conversations, I'm surprised more people don't do what we do. It is the most amazing field. The conversations we get to have are conversations that a lot of people want to have. People want to talk about intimate issues. And who doesn't want to have these conversations all day long? You think about talking about peeing, pooping, and cancer care, and all those conversations are so important. But I think the intimate conversations can be really fun conversations to have, where when people leave our offices, they're like, heck yeah, like my life is about to get better.
Oh, that's such a good feeling. I love that. So what is one trend in this industry or in men's health in general that genuinely excites you?
I'm big on, no pun intended, cosmetic procedures for men. And that is something that we're not really taught how to do or how to talk to patients about in our training. It's something that I've delved into once I've been in my own practice in the Miami, Florida area. But I do a lot of penile girth enhancement in my current practice. And I think what I like so much about that area of my practice is I get to sit down with people, whether they're patients or other colleagues, and explain to people ways that we can safely help them feel better about themselves and feel better about, their role in their relationship. I think what I like about it too is that it's such a polarizing topic. It is so polarizing. People have very strong opinions on this topic. And I come about it in a way that I try to spark curiosity rather than feeding into this polarization of this topic.
Yeah, yeah. Oh, and I can only imagine that's life-changing for your clients.
It can be. Now, will I tell my patients that if I do this procedure, it's going to change their life in all these different ways? I don't, because for some people it's not. For some people it's literally, I'm just going to make one organ of their body bigger and it might help in some ways, but may not, fix everything in their lives. So I don't oversell anything.
Yeah.
And we talk about the different ways where it can make things better.
If you could teach the world one key insight about this field, something that really moves the needle, what would that be?
I feel so strongly about optimizing people's hormones. I was recently
Mm.
having an interview with Dr. Abraham Morgentaler, who is considered the godfather of testosterone therapy. And in this discussion, talking about testosterone in men, he states that having reduced testosterone is a reduced state of the human being. And there's so many people that are just so stuck in the status quo in the everyday, and they think, oh, it's midlife. I don't quite feel like myself and I don't have that same pep in my step, but maybe this is just what it is to get older. Hormones can really play a major role. And now that discussion is really all over the place.
Yeah.
And so I think it's good that we're having this discussion, but in a conversation that's evidence-based and safe is really important. But I'm a huge proponent of hormones, and they can really help people, level up and live the life they want to while they have this limited time on earth.
So I want to talk to you a little bit about hormones, specifically testosterone. For men, when should they start thinking about like having their hormone levels tested? Or is it safe for a man to go into like a supplement store and like start getting testosterone? Like, what do you think about that?
I have so many thoughts, Michelle. So the first thought is I don't recommend, and none of my colleagues would really recommend someone going into a supplement store and taking something over the counter when it comes to like a testosterone booster. Research has shown that a lot of those products that are available over the counter are not actually what they say they are. They have other things in them. Okay. So that's the first thing. I wouldn't recommend someone taking something that's over the counter when it comes to testosterone therapy. Now, there are some supplements that can help boost the hormone pathway. The problem is, and there is some research, in this area. Some of my patients ask about medications like D-aspartic acid, ashwagandha, things like that. For the most part, if we want to optimize our hormone pathway, then optimizing sleep, nutrition, exercise, sleep, and stress, those are really the holy grails. And so if people are looking for other things that they can do to optimize their hormones, we have 4 things right there that can be very helpful.
Yeah.
And nutrition really does play a role. So instead of someone taking, let's say, a supplement to try to counteract maybe some of the bad things that they're eating, I would say there's nothing that's going to counteract a bad nutrition program. So I would really hone in on the nutrition, and then that will allow someone to minimize their supplements. So even though there are supplements that may be helpful, there aren't really any supplements in this space that I'm recommending to patients. When should someone be concerned or curious about checking their testosterone? And I say, I don't think it's ever too early to check a number. It doesn't mean we have to do something about it. But Michelle, you cannot track what you do not measure. And these days, information is knowledge and information is power. And I have patients that will come in and they're like, hey, do you mind in a month if we just recheck, whatever labs? And I say, yeah, that's just another data point, So for some of my patients, if they want to check their labs a couple times a year rather than maybe a standard, annual lab draw, I'm totally fine with that. Now, if insurance doesn't cover it, they know that they might be paying out of pocket, but a lot of my patients, they don't really care. Honestly, for a lot of these tests these days, you can go on Quest Health and you can order your own tests to get that knowledge.
Yeah.
So I have patients that come in and they might be in their 20s and 30s. These are young men, generally like pretty healthy. And as part of their visit, it doesn't matter what they're coming in for. I will offer if they want me to check their testosterone. But the problem is there's no screening guidelines. There's no guideline that says when a man hits 30, he should start having his testosterone checked. But the important point too here in this discussion is as people get older and they have issues or they may have issues with low testosterone, it's not necessarily the absolute value of their testosterone where they might become symptomatic. More and more people are talking about the delta. So let me give you an example, Michelle. If someone, let's say, is 40 years old and they feel great and their testosterone level, let's say, is 700, and then let's say they're 60 years old and their testosterone level is 350. Well, Michelle, 350 is still normal, but that delta is 350. So they're feeling that change. And so even though their absolute value is normal, they might be feeling or symptomatic from having a lower testosterone level. But if you're only checking that man's testosterone when he's 60, you never know what his delta is.
Yeah.
I like data.
Oh, for sure. It's so helpful. And so, what could be like some common signs that there might be something off with testosterone? Like, is it more common for it to be too low or too high? What are some things men should know about that?
So some men will have higher levels of testosterone in terms of like that normal range, which doesn't worry me. I mean, usually if someone has
Mhm.
like a really high testosterone, usually that's a sign of like, hey, are you taking some testosterone therapy, right? But it's
Yeah.
rare that I would see someone where I'm like, oh my gosh, why is that guy's testosterone level so high when he's saying
Mm.
he's not on anything?
Yeah.
It's more so having low testosterone levels. Now, that's where it becomes a little bit tricky too with testosterone because the symptoms that are commonly associated with low testosterone are pretty vague, right? And they can impact everything from the head to the toes. Common symptoms include brain fog, reduced motivation, difficulty with or changes in sleep patterns, could be depressive symptoms, anxiety symptoms, increased irritability, could be the person is going to the gym and they're lifting weights and they used to be able to gain muscle when they put in the work and now it's really challenging to gain muscle or feel stronger. Maybe 5 years ago they were able to drop 5 or 10 pounds if they ate a little bit healthier and moved their body a little bit more, and now they're struggling a bit to lose that weight. It could be they have reduced motivation, their work performance may be suffering, could be increasing fatigue. Wow, a lot of those symptoms are so vague.
Yeah.
And they could be due to so many different things. They could be due to depression. They could be due to someone's work schedule and stress and family life and maybe being overweight or having a thyroid issue. And so it's not specific for having low testosterone. If someone is coming in with those symptoms or even just one symptom, why not check their testosterone?
Yeah.
Right. And then, I always ask myself, but let's say someone has like a low normal level and they have some of those symptoms. The question is to treat or not to treat. That's
Mhm.
like the $1 million question.
Yeah.
And I ask myself, how could I hurt this person if I treated him?
Mm.
Because that's actually the most relevant question.
Yeah.
If the medication is effective or ineffective, like, of course, that's important, but that's not the number one driving factor. The driving factor is if I put someone on this therapy, how could this therapy hurt him? And I want to give you an example, especially being in South Florida in Miami, where a lot of older men, I'm not going to call them old, but a lot of older men are with younger women. And so they might be interested in current or future fertility. And I can make no assumptions. So if I see a patient in the clinic and let's say he's 60 years old and he's going out with someone younger, I will ask him, are you interested in current or future fertility? Because if I put that guy on testosterone therapy, I can wipe out the sperm in his in a very short period of time.
Mm.
And that's how I could hurt him.
Yeah.
If a guy has undiagnosed or untreated sleep apnea and his blood is thick and I put him on testosterone, I could potentially make that worse. So
Mhm.
those are the questions that I ask. And then I'm hoping at the end of the day, yeah, if I can I help this guy with his energy, build more muscle, and oftentimes we can.
So, a lot of us have men in our lives, a lot of men might be watching this. So, if they are even suspecting that there might be something off with their testosterone, would you recommend that they go to a primary care doctor first or go to a urologist first? Like, what do you think?
Yeah, I love that question. I've been asked that question many a time. The reality is it matters and it doesn't matter because there are some primary cares that really delve into the hormone space or that are
Yeah.
totally fine checking hormone levels. And there are other primary care doctors that say, well, you have a beard and you have muscles, so you don't have low testosterone. You can have low testosterone. And so they won't check it. There are doctors that, because they don't know how to treat low testosterone, you don't want to check something that you don't know what to do with it if it comes
Mm.
back abnormal. So some people don't even want to check a lab because they don't know how to interpret the results, or they don't have someone that they could refer that patient to if the lab comes back that's problematic, right?
Yeah.
So it depends when it comes to primary care. Some people say, is an endocrinologist better? Is a urologist better? I know plenty of urologists that have no interest in treating testosterone issues. And then I know plenty of urologists that love having the testosterone conversations.
Mm.
Same thing with endocrinology. So my point is, it matters less the specialty and more is the person that you're seeing willing to check your hormones, number one, right? And number two, if they're willing to check it, but they can't interpret it or treat it, then just knowing that you might need to see someone else after you get those results. But the range for normal testosterone is a huge range. And depending on the lab that you go to, that reference range could say that normal is, let's say, 250 to 900. That's a big range.
Yeah.
And so whenever I am having conversations with patients, I'll ask, have you had your testosterone level checked? Oftentimes they'll say, yeah. And I said, do you know what the number was? And they'll say, oh, I was told it was normal. And I'm like, if you don't mind and you can get the records, I'd actually love to actually see what that number looks like so we can have a more nuanced conversation, because normal doesn't always mean normal. And it doesn't always mean that you don't have any room to optimize how they're feeling.
Yeah. Oh, what a great takeaway. It sounds like, better to have your level checked. And so you know what your baseline is. That way you can easily tell if there's something going on later on.
Yeah. And even though all those symptoms that I described, as I mentioned, could be due to 100 other things and probably 300 other things that we haven't identified, testosterone is not going to fix everything. But I'll tell you this, Michelle, when you optimize someone's hormones and they're coming in with, let's say, 10 different symptoms, people are complex. And it's like if you take apart a watch and you look at all the different gears. So we know all these gears need to move, but you don't have to move them all at once. Sometimes all you have to do is move the first gear. And that's what I look at. That's what I imagine when I'm thinking about testosterone and hormone optimization. If I can get someone feeling a little bit better when they wake up in the morning, whereas instead of it taking an hour for them to get up and go, they wake up and they're like, I'm ready to tackle the day. So they get up a little bit earlier. Because they get up a little bit earlier, now they're helping their wife get the kids ready for school. And because now they're helping with that, now she wants to improve their intimate lives together, right? And
Right.
actually a real story that I just heard from one of my patients. They're in their 40s and they've been seeing a therapist for some of these marital issues.
Yeah.
But now he's waking up, he's helping with the kids, and he was like, this has been amazing for my marriage.
I know. It's so fun because we always joke and we call it like chore play and like, helping out around the house. Like, whoo, that'll get you going. All right. My last question for you. If you could leave one message for the next generation about men's health, what would it be and why does that matter right now?
We oftentimes think that women have it really challenging and that women are left out when it comes to the healthcare discussion. And I'm not saying that we don't have a challenging time in the healthcare place, but men don't have it all either when it comes to their healthcare. In fact, there are no healthcare providers that have any mandatory training in the health of a man when it comes to like his intimate health and his reproductive health. So my message for the next generation is we have to do better. We have to do better when it comes to educating people who are going to be taking care of patients to really take care of both women's health and men's health issues. Because right now we're doing really a piss poor job of it for honestly everyone.
Yeah. Oh, such a good point. And that's why it's so important, like the things that we do at our organization and bringing in professionals to train other professionals about intimate health topics, because we need more education in all spheres of this. So thank you so much, Dr. Amy Pearlman, for being with us today.
Thank you for having me.